Thank you. Thank you. Well, I think Tom just about gave my presentation just now. You hit all the high points. That was great. Okay, so let's start out just with a few questions. Who here has ever had surgery before? Oh boy, most people. Who has had dental work before? Hopefully everybody. And who has had a painful medical procedure like a biopsy, a blood draw? Okay, right. Just talked to a man yesterday who said he passes out every time he has blood drawn. So what are the feelings and what are the thoughts that go through your mind when you're going through something like that or when you're planning for something like that? What are some of the feelings that pop up? Anxiety. Scared.
I don't want to be here.
Don't want to be here.
It's gonna hurt.
It's going to hurt. Will I survive? Will I embarrass myself by calling out for mama? So in 1996, I was called to work with a 71-year-old woman who was getting ready to have heart bypass surgery. And it was news to her that she needed anything like this, and she was very, very frightened. So I went to her hospital room with what I had available at that time, which was a Discman, some headphones, and a stack of CDs. And we started going through the music to try to find what would be calming and relaxing to her. And I explained about rhythmic entrainment, and I'll say more about that soon. But in the end, her anxiety really actually prevented her from even thinking about what music she wanted to hear. And finally, she said, Alice, just pick what you think will be best as long as it's not nearer my God to thee. This is the lady. She survived beautifully. She said that she would never have surgery again without music, that it made such a difference. She had had lots of surgery in the past. And she said that the benefits she experienced were that she woke up feeling oriented, first of all. She knew where she was. She knew that she had survived the surgery. She also said that for once she did not have nearly the nausea and vomiting that she normally had post-op. And possibly best of all for her, she said, was that in the recovery area, there are just curtains between each patient. And had she not had the headphones on and the music playing, she could have heard the people on both sides that were moaning in pain and calling out for the nurse and things like that. So it was quite a positive experience. The problem before surgery or dental procedures is the anxiety. And anxiety causes your muscles to tense up. It causes your heart to beat much faster in a fluttering sort of way. And it causes your breathing to be very shallow and rapid. So what is the solution for this? The solution is a process that I discovered when I was working at the U of L School of Medicine doing research on the healing power of music. It's called rhythmic entrainment. And rhythmic entrainment was discovered in the 16th century. It's well documented. It's a process that is used or talked about in physics quite a bit, but it also happens with humans. So that when we hear strong, steady pulse of music, we want to keep time to that. So when you hear bum, bum, ba-dum, bum, 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 what do you want to do?
Get up and march.
Get up and march. Swing your arms, clap your hands, tap your toe. That's the power of rhythmic entrainment. So what I discovered was that people also respond to a slow, steady pulse. And that is what comes through the cordless headphones. I have spent quite a bit of time choosing the ideal music for surgery. So that is a very important process, the rhythmic entrainment. And Surgical Serenity, that's what we got our patent on. This is a woman who's waiting for her procedure, listening only to the relaxing music. She has an IV, but that's just for fluids. until recently, they usually gave you Valium or Xanax in your IV as soon as you got to the hospital. And that is something that in this day of the opioid epidemic, we don't want to be having any more potentially addictive drugs than we absolutely have to have. So, the last person that I would like, well, let me first mention the procedures that these headphones have been used for to date. All of these replacement surgeries, and one of the things you need to know, especially we baby boomers who are having our joints replaced, in a joint replacement surgery, you have hammering, drilling, and sawing. Nobody needs to hear that. Nobody wants to hear that. It's very unnerving. I mean, talk about anxiety provoking. Just so that's why I would think if you know that that's going to be going on, and usually they don't put you under general anesthesia either. It's regional anesthesia because they want to not give you any more anesthesia than need be. So I started out with surgery in mind, but people have also come to me with all kinds of other uses like chemotherapy, root canals. One lady wore them fear of flying because she had to ride on a helicopter unexpectedly on a vacation. And she found out before she left the U.S. she was going to have to ride a helicopter from one Greek island to the next, and decided that she would try the headphones. Insomnia, we've definitely had people use them very successfully for insomnia. So our last patient that I want to tell you about quickly is a man you may know, John H., formerly a member of this chapter. He was having a pacemaker implanted, and he had 2 heart attacks. He had had 2 heart attacks and also had a diagnosis of Parkinson's disease. So he took the headphones to the hospital, and he said that when he got there, the anxiety was fully present. His body temperature had actually dropped to like mid-80s or something, I think. His blood pressure was very low, and they almost sent him home. And then he thought, oh, I've got those headphones. So he put the headphones on, and he said that within a matter of minutes that his body temperature started rising, his blood pressure started normalizing and stabilizing, and he ended up having the entire procedure, which had been expected to be almost 6 hours. He had the procedure in 1 hour and 50 minutes. He went home the next day only with Tylenol for pain. And he said, Alice, I don't know for a fact that it was the music or whether it was the music or the headphones, but I know that it was very comforting to me. It made a huge difference. And by the way, the surgeon was playing very loud, upbeat music, which surgeons do, and they have a right to play what keeps their energy level up. But he said, I was so glad that I had your headphones on. It made a huge difference. So I'm going to be giving away a headphone later tonight. If you put your business card up here, we'll have a drawing at the very end. But if you have surgery in your future, dental work, joint replacement, a baby, whatever, please consider getting yourself some headphones. If you are a doctor or a surgeon, please consider getting them for your hospital. Patient satisfaction ratings go up, which can raise reimbursement rates. It's a win-win for everybody. Thank you.